I'm Braden Richmond with Special Care for Women here in Anniston. I've been here for 19 years. Well, the people are great. I'm from Birmingham, and it's nice to be in a little bit smaller community. The people are welcoming, and I think that everybody's got a good feeling of community here, and I think that's really important. How do I know I can get pregnant, or why haven't I conceived? And it's a hard question to answer. A young patient who's not interested in conceiving yet, I guess the first thing that we'd like to know is, are you having regular cycles? Because if you're having regular cycles, then you're ovulating. You have to be able to ovulate to conceive. A lot of people that are coming in that have just started getting pregnant wonder why they haven't conceived. And we know that it takes the average couple at least 6 months to conceive. We know that 80% of couples trying to conceive will conceive in their first year of trying, but what's interesting is take the other 20 couples out of that 100 that didn't conceive, and 16 of them will conceive on their own without any help in the next 12 months. So it's okay to begin an infertility workup after 1 year, but definitely ought to consider having an infertility workup after 2 years of trying. There can be several issues why somebody can't conceive, and the first one is, are we ovulating? If a lady is ovulating, then she's releasing that egg, and of course that's required for conception. But also 20 to 40% of men have some kind of an infertility issue and need to go see a urologist, need to have a semen analysis first, and based on the results, need to see a urologist. If the semen analysis is fine and the young lady is having regular cycles, we want her to do ovulation detection kits to confirm that those are indeed ovulatory cycles. And if they are, the next step is a dye test that RMC performs. It's called hysterosalpingogram, and that makes sure that there's no blockage in the uterus or the tubes. If that's normal, then we end up going to laparoscopy, and we can do advanced laparoscopy at RMC. We can use robotics, and we can look for problems like adhesions, tubal blockage, endometriosis, and those are same-day surgeries with easy recoveries with the technologies we have. If a couple's planning to get pregnant, we look at the woman's overall health. It's real important for some things like hypertension or diabetes. We want blood pressure to be in good control. If somebody's diabetic, we want to see what their A1C is and let them work with their physician to really get their sugars under control prior to pregnancy. It can reduce birth defects. Weight is a problem throughout the country, and in the same way, it's that problem in this community. So we want women to work on their weight. We want them to practice good habits. If they're drinking heavily, if they're smoking, we want them to cut down or stop those respectively. It's amazing how many people are using marijuana casually, and it's something that we just need to address. It can affect brain development, and so they need to stop marijuana use prior to pregnancy. As far as other habits, we want them to keep up with their cycles. We want to know if they are having good cycles, and we want them to be able to tell us when their last cycle was. I think what's neat about all of our physicians is that from preconception to any infertility issues all the way to postpartum care, you have complete care here. Again, we can take care of any of the infertility issues with advanced modalities that we have here. Our physicians feel great taking care of high-risk pregnancy, so whether you're a normal or high-risk pregnancy, you're not having to go to Birmingham or Atlanta. You're able to stay here and have your issues addressed. And then the delivery at RMC is great. We have one of the lowest C-section rates in the state. We have great experienced nurses. We have wonderful anesthesia. We have 3 C-section rooms, so they're right down the hall. If we need to do an emergency C-section, it can be done quickly without problems. We have incredible low complication rates, better than some of the hospitals in Birmingham, and a lot of people don't know that. So, and then, the postpartum care, getting you through the pregnancy, the postpartum care in the hospital, the ability to get your doctor quickly on the phone if you have a problem while you're home with your baby, all the way through the 6-week check. So from before pregnancy until after delivery, we can offer great care here. We're a well-kept secret. You can see things on social media, whether it be TikTok, Facebook, Instagram, about a hospital maybe having some concerns about the care. If I had too many concerns about the care, I've been doing this for 28 years. If I felt that RMC couldn't do a good job, I would be forced to go somewhere else. But I'm really shocked at some of the care that I see patients received when they were at a big group in Birmingham, and certainly in all of our practices, we can provide much more personalized care, much more hands-on, and we really do get better outcomes. And it's borne out by the data. It's just something that a lot of people don't know. We have some great new pediatricians to go with our very experienced pediatricians here, and they do a tremendous job with our newborns. Sometimes people come in and we don't have time to transfer somebody who's 33 weeks pregnant, and we can provide that care here. Some of those babies don't even need to be transferred, but they can certainly be taken care of to be stabilized if they need to be sent to Birmingham. Our newborn nurses are highly trained, and they can take care of preemie babies. Our labor and delivery nurses do an excellent job, not only of being able to take care of our patients, of taking care of them during their labor, about coaching them for their deliveries, but also in the immediate and the long-term postpartum care. So our staff is excellent.